Assalamu alaikum. Good afternoon, ladies and gentlemen. It is my pleasure to be here today to talk about a topic which is important not only for the healthcare provider, but also to the families who have patients affected with certain diseases. I would like to thank the SSCP for the kind invitation and the Ministry of Health. And today I will talk about the journey to rare diseases to get the diagnosis. Can someone, yeah. In population genetics, what we focus on is the distribution of genetic diseases around the world, whether if it's communicable or non-communicable diseases. In non-communicable diseases, the effect of diseases comes from ethnicity, environmental, wars where people drift from one area to another and change the genetic component, and also affected by socio-economical status. Certain diseases are more common in certain regions, whether it's common diseases or rare diseases. In common diseases, it's a bit, let's say, well constructed in the case of prevention and early intervention and the screening program. As an example, for cystic fibrosis, where it's mainly affect the Caucasian population, the distribution among the diseases, among the affected individual are in the region where the most populated by Caucasian population. In contrast to that, where the hematological disease is most common in regions like MENA region and North America and South America. Why this is important and what is the current situation in Saudi Arabia? In our population, most of the marriages occur among family members. The percentage of consanguinity is 50%, and among those 50% are actually involved in first-degree marriages. Screening program is very important. However, we cannot screen for rare diseases. As we say in Arabia, النادر لا حكم له. However, there is ways to prevent those diseases from spreading and find certain solution for them. The test for carrier screening is actually happen once in a life, and the individual would know if they are affected with or will be affected or affect his offspring in the future with certain diseases. It's important for early detection, early intervention, and also for the decision making in the government. Carrier screening is actually a good method, or let's say a golden standard to reduce the incidence in the future. Family history is also one of the indicators to target specific testing for specific diseases. In Saudi Arabia, the Ministry of Health implemented two programs, the pre-marital testing and the newborn screening testing. They are working efficiently. However, it's not covering all the diseases. There is a number of initiatives and studies presented in Saudi Arabia on which is the common diseases distributed in our population. The gap in those studies is that those studies focus on regions or institutions. Also, the genetic, the allele distribution from those tests represent the study population group. It doesn't cover everything. As an example of family study, lipodystrophy is not included in any program, whether the premarital or newborn screening. However, still we have a larger proportion of people who's affected by lipodystrophy. The problem with the disease, it's late diagnosis and it's misdiagnosed by diabetes. We have here a family composed of mom and dad whose consanguineous marriage produced two daughters affected with lipodystrophy. Lipodystrophy causes a burden to the health care, where it's cost 3 million per year per individual. In carrier screening testing, some of the individual in the family is already married and over age to produce any symptoms. However, for the others, which is the focus group, carrier screening is very important to at least tell them if they are going to develop the disease in the future, or actually going to marry to someone from the family, trying to avoid individuals who's actually carrier to produce kids in the future with the same phenotype as the sisters. This is very important for family screening, where we actually can control the future offspring while the current case or status cannot be changed. Screening program usually cover conditions that, let's say, most dominantly in Saudi population or any other population, and if there are a diagnostic test and preventive plan and a treatment for them. In this case, for rare diseases, it is difficult. There is no test for some of them, and the condition is dodgy in most of the cases, and the treatment not always available. As an example, this is a case study from a family from the United States where the father is actually an AI scientist. His son diagnosed with ultra-rare disease. In ultra-rare diseases, there is no cure, no medication, nothing. It's new. Unlike the rare diseases, which we have a big portion in Saudi Arabia, as included in the newborn screening program as a metabolic disorder. In rare diseases, nothing, it haven't been identified before or identified but not reported. I don't know if the technical team can work on the voice. Anyway, in this case, Matt Might, a professor in AI, he was struggling to find a diagnosis for his son for almost 5 years. And this case have never been reported, and nobody knows anything about it. The problem here, to find the diagnosis and to find the right treatment. Matt, fortunately, is a computer scientist where he worked in artificial intelligence to extract the mutation that found in, carried by him and his wife to produce the disease called angline 1 deficiency. It's a deficiency of an enzyme. It is ultra-rare variation, not reported in many places. Through this, he actually find other cases and register them and start to study the disease in depth. The phenotype of lack of the enzyme angline 1, untreatable neurodegenerative disease. The patient most probably stay in a wheelchair for the rest of his life. Seizures-like activities in the brain, severe developmental delay, and inability to produce tears. The disease inherited as autosomal recessive from both parents, and the probability of having an affected child is 25%, though they have also 25% probability to have a normal child, 50% as a carrier. In certain variation, it is easy to distinguish one pathogenic variant from a normal variation by having certain criteria assigned by the American College of Medical Genetics and Genomics. Certain variation most probably causing diseases and have been observed before, so it's easy to diagnose. In cases of ultra-rare variation, it is not reported before. The molecular pathway that's involved in the disease are not detected, so it's difficult to understand it. The problem sometimes is not only in the genomics, it's post-transcription or translation. And sometimes it's involved the epigenetic. The only way to understand it, not only by sequencing or studying the epigenetics, it's also analyzing the data in a certain way to show which is the pathway disrupted and what is the effect involved. So I don't think the voice will work. Matt Matthew, he actually worked on finding precision medicine for his son by screening number of medication approved by the FDA, and he found that certain medication involved in, it's called pyric acid, involved in used for stomach acidity is actually working on his son. This is by creating a database of certain drugs available and the pathway that it's involved with, and from understanding the mutation pathway, you can target the pathway by replacing the component by a certain medication. Matt Matthew assigned as an advisor at 2015 for President Obama in the United States in a precision medicine initiative. What he actually did, created a database as well with the people who's affected with angline 1 deficiency, understand the genetic background and the pathway that disrupted by those mutations. Rare diseases roadmap. In certain point, doctors struggle to find the appropriate diagnosis. However, we always can prevent diseases. Finding the genetic variation associated with the disease will be the first step of this journey. Understanding by research what this mutation does, it's another part of it. Precision medicine, targeting the pathway that's affected on the patient, is one of the solutions that's currently available. I would love to present this in depth. However, I will give an overview. This is one of the tools that Matt White actually created. When he didn't find a proper diagnosis for his son, he created a database composed of 80 databases and 29 million articles, where the input is the symptoms that the patient have. Then it will give you the most predicted diseases that associated with those symptoms. This will help clinicians to find the appropriate diagnosis for the patient. It's not only on the genetic, human genetic level. He works as well on metagenomics, where his kid once hospitalized for unknown infection, taking lung aspiration and culture the lung aspiration and sequence all the genomics from the bacteria and the pathogens. There, he actually found the bacteria involved in his son infection, and he chose the targeted medication antibiotic by doing this procedure. This is everything from my side, but I would say at the end, it's research, research, research to find the solution. Thank you.